In this tutorial, we're going to talk about how to report for the Healthcare Employer Council's Labor Planning and Forecasting Project, specifically the files, the Rosetta, and the Employer Report. So to report for this, you're going to need two files. The first file is the Healthcare Employer Council's Rosetta Stone Phase 1 All Descriptions and Surveys. The second one is the Healthcare Employer Council's Labor Forecasting Employer Report. I'm working with version P1.7. You might be working with a newer version, in which case follow the instructions and just use this tutorial as a guide. Okay, let's begin. Now the first thing you'll need to do is you're probably aware at this point that we're looking at these 11 occupations for the Phase 1. And so what you want to do is develop a preliminary list of the job codes that you think from your organization match with these 11. Okay, so open up Healthcare Employer Council's Rosetta Stone Phase 1 All Descriptions and Surveys, and open that up. Let's see, and what you'll see is a preliminary list. So looking at those 11 codes, I'm going to create a list. First, I'm going to think, okay, maybe the Alliance for Health has an RN level 100, or it's called RN level 1 and RN level 2, and maybe we have a radiological technician, and maybe what we have that I'm going to consider for this is a dietary aide. Okay, now not every organization has job codes that go along with, or job codes that complement the job title, but in case you do, add those in because those are helpful. And so I'm just gonna put these in. Rad 100 and DA. Okay, I'm just kind of putting these together just as an example. Okay, now that I've come together and made a preliminary list, what I'm going to do is I'm going to use these tabs down here to make the decision whether these actually match the different ONET codes. Okay, so starting with an RN, I'm going to open up the RN tab, and what you see here is we've defined, or the ONET has defined this job code by certain core tasks and supplemental tasks. So what you'll do is you'll take the job description of the job you're working with. So I'll take RN 100. I'll ask the question, okay, the RN in this position, do they monitor, record, and report symptoms and changes in patients' conditions? Well, if so, I'm going to check yes, and then I'm going to move on to the next ones, and then I'm going to move on to supplemental tasks and go through those as well. At the end, I'm going to look at how much has been checked, and I'm going to make a judgment call as to whether it was a good match or not a good match. So you may be asking what quantifies as a good match. There's no real rule. You kind of have to make that decision yourself. So it could be 90% similarity, it could be 80%, it could be 50%. It's up to you to make that call. If you are working on this and you are not familiar with a specific occupation, well, what you can do is you can actually print this out and use it as a survey. So put your name here, find a manager or someone in this position, put their name here, and then say I'm investigating RN level 1, which is RN 100. So, and just go from there. Okay? And so what you'll see is all the 11 occupations, we have different tabs. So here's the radiological tech, and there's the farm tech, surge tech. Okay, so I'm going to say that this RN, I've looked at it, checked all the boxes. I feel like it's a good match. And I did the same thing with the RN level 2, and I would say it's a good match. I also did it with the radiological tech, say it's a good match. The dietary aid, unfortunately, it's not a good match, so I'm going to click other. Okay, so there we go. I have finished with this piece, and I'm ready to move on to the next. Okay, now that we have developed the preliminary list, what we're going to do is we're going to open the Healthcare Employer Council Labor Forecasting and Employer Report. So let's do that. I have mine already open, so here we go. Now, what I want you to know about this is that there's 3 tabs. There's the instructions, there's the Rosetta, and the report. Okay, the instructions tell you exactly how to go through each phase and complete it. It's very detailed, and if you follow them, you'll be just fine. Anyway, so the first thing you want to do is to click Save As, and there's a little bit of instructions right here of how to save it properly, but we're going to do HCEC underscore RER, that's Rosetta and Employer Report, underscore, and we're going to use the name of your organization. Then you're going to do an underscore again, do the quarter that you're reporting for, and then 2011, so the quarter and then the year, and then click Save. Okay. Now that you've done that, you're going to move to the Rosetta tab. You're going to fill in the name of your organization here. So mine is Alliance for Health. Then the organization's HCEC representative. So if your organization has someone on the council, put their name here, or at least put the primary contact between the Healthcare Employers Council or the Alliance for Health in your organization. So I'm going to put down Craig Nobelin for me, or for the Alliance for Health, and then since I'm the project leader, I'm going to put my name down. If someone else is working with me, I'd put their name down. Since I'm not, I'll do this just for example purposes. Okay, you're going to skip the comment section. Now, right here, this is going to look pretty similar. So what I want you to do is return back to your preliminary list. What you're going to do is you're going to copy and paste all the ones that you said connected with anyone. There's actually kind of a nice way to do this. You can actually filter, and you can say I don't want to select the other ones. Click OK, and there you have it. You have all the ones that line up. So copy, and then switch back to this one, and then paste. Pretty easy. Okay, so now that we have this started, I'm going to start with RN 100, or RN level 1. Now, for the Alliance for Health, we're going to say that we need the associate's degree. That's the required education for this position. And then for the education preferred, we'll just say maybe the Alliance for Health prefers a bachelor's degree. Credentials required, state licensure is important, obviously state of Michigan. Preferred credentials, we're going to say for the level 1 nurse, we don't prefer any more credentials. Now, on the job training, this is a question of if your organization does train people for this position. So, for example, if you had a home health aide and your organization actually takes people, quote unquote, off the street and trains them through an internal program, then you would select yes, you do have an on-the-job training program. For nurses, you're not going to have an on-the-job training program, or at least that would be incredibly rare. So we're going to select no. Now, this on-the-job training is non-orientation. There is generally a several months orientation program for new nurses, but that's not on-the-job training. They get their training at an accredited university. So next, we're going to look at setting. Now, setting refers to kind of where they do their work. So, for example, you might have acute care, ambulatory care, rehabilitation, behavioral health, home care, long-term care. Durable medical equipment vendor, this may confuse some. This is referring to like your CVS pharmacy or professional pharmacy. So it's a lot of where pharmacists work. So that's what a durable medical equipment vendor is. Okay, so we're going to say that our nurses function at a rehabilitation setting. Now that's the primary setting they function in. Every once in a while they may work in a different setting, so we'll just say home care. Sometimes they do home visits, so we'll say that is also a setting. Okay. Now what I'm going to do is I'm going to go back and fill in all this information for the other two and do the same thing. Now when I've completed that, I'm going to move on to the next piece, which is filling in the hiring information. Okay, now that we've completed this page, we're going to move on to the next report. So let's go to the report tab here and click on it. And let's see. So you'll see that most of the information that you've already typed in has been linked, and it's already filled in for you. So that's kind of nice. And then we're going to start up here with quarter start. So the beginning of this quarter, let's say if it's the third quarter, would start on July 1st of 2011. Okay, and then I'm going to fill in the end of the quarter, which would be September 30. Okay. I would like to point out at this point that there are comments. Anytime you see these red kind of flags in the corner of the cells, there are little comments that you can read, and they'll give you a little bit of a guide. But the instructions have all the details that you'll need as well. So, okay, the next thing to move on to is total number of FTEs within West Michigan. So for this, find out the total number of full-time employees, or the FTE total, for your organization for those that are operating with within the 12-county region of West Michigan. So that 12-county region is defined as Allegan, Ionia, Kent, Lake, Mason, Mecosta, Montcalm, Muskegon, Newaygo, Ottawa, Osceola, and Oceana. Okay, so let's, for example purposes, Alliance for Health perhaps has 200 FTEs within West Michigan. So now the next question is the total number of employees. So what's the head count of those operating within West Michigan? And this should always be larger than your FTEs, except in very rare situations. So in this case, we have 250 employees and 200 FTEs. Okay, I'm going to skip the comments section, move on. Now for RN level 1, I'm going to now take kind of dig through the information in my organization and find out the total number of employees that were operating as RN level 1s during or at the beginning of this quarter. So how many were hired on day 1 of this quarter? So on July 1st, how many RNs level 1 were hired in my organization? Or not hired, but operating within my organization. So we'll say 20. Now at the end of the quarter, or actually the first day of the next quarter, so this would be October 1st, I'm going to find another snapshot and say how many RN level 1s were operating within my organization, what was the head count at that date. So we'll say 22. Right? And then I'm going to ask, over the course of the quarter, how many RN level 1s were hired? Okay, so I'm going to say that 4 were hired and 0 retired. Now, you might be wondering, okay, well, we had 4 hires, but the totals are different. That doesn't really add up. It's because there was some turnover. So 2 people turned over, and so we had to hire 4, and we did grow. So, okay. Now I'm just going to do the same thing for each one of these codes, and that's it. So just save the file and send it to hanspalma@afh.org. And that's it. If you have any questions, you can email me at hanspalma@afh.org, and I'll get back to you. And also, just want to point out at the end, if you have any questions, any comments, or if you weren't sure because the data didn't really line up with what we're asking for, just write any assumptions or any details you feel we need to know right here. All right, that's it. Thank you very much.